Hi friends, I am Dr. Tapsin Rathod. I have done MD in Voice Medicine. In today's video, we will continue with topic about snakes. In last video, we discussed about common the features of common poisonous snakes in India. In this video, we will discuss about snake venom. Snake venom is nothing but the salivary gland of the poisonous snakes. The venom glands are the salivary glands of the snakes and are situated behind the eyes, one on each side of the head above the upper jaw. So usually these are the fangs which the glands are present in the upper part of the glands which are present inside the maxilla of the snakes. All venomous snakes have two fangs. So these are the fangs which are called as fangs. They have like a hypodermic layer. They are hollowed out and the gland is present inside the maxilla. They are curved teeth situated on the maxillary bones and are attached to the parietal glands situated behind the both eyes, lie along the jaws and are covered by a flap of mucous membrane. So there is a flap of mucous membrane is present, as well as the gland is situated inside the maxilla. When snake is about to bite, they become erect and point directly forwards. So whenever they want to bite, it becomes prominent. They are bigger than the other teeth and are grooved or canalized in the venomous snake. When a venomous snake bites, it normally leaves two deep faint impressions are present, distance between about 8 mm to 4 mm distance. There are two bite marks we've seen. A side swipe may produce a single puncture and also small marks of other teeth may present. Sometimes there may be two marks, sometimes there may be only one marks with tiny bite marks of the other teeth which are not prominent, present in some snakes. They are solid in non-venomous snakes. So fangs which are fangs that the teeth of the snakes are solid and they are not that is not hollowed canalized. Many non-venomous snake species have two enlarged teeth that can produce two puncture marks. So even some non-venomous snake also can have two prominent teeth followed by smaller other teeth which looks like a bite marks. Non-venomous snake bites leaves a number of small impressions in the road which is one indication that it is a non-venomous snake. The fang can penetrate deeply, but part of the most of the venom may be ejected superficially externally without entering the wound. So whenever the snake bites, sometimes it may penetrate deep or sometimes it may be present ejected superficially. As such, even a thin layer of clothing may afford great protection whenever the snake bites. As venom is injected superficially by vipers and also by the elapids and heterophiles, about 20% of patients bitten by venomous snakes do not show evidence of poisoning, even though the fangs have penetrated sting, which is termed as dry bites. So among all the bites, only 20% of chances are there that the person may get that the snake bites and the venom is injected. Most of the times, even when they bite, there is a dry bites without any ejection of venom. In sea snake bites, symptoms are not produced in about 80% of bites. The exact number of fang marks may vary because of glancing blows, multiple fangs, multiple strikes, or form protection from the clothes or shoes. So in snake bites, sea snake bites, typical marking will not be present, and because there may be sometimes because it is in water, it may be bite one time or multiple time it may be bitten. So and also the symptoms are not produced in 80% of cases. Venom is usually is the saliva of the snake. So cobra venom is venom of the cobra is faint transparent yellow in color and is slightly viscous. When exposed to air, it becomes slightly turbid. Rhesus viper venom is white or yellowish in color. Venoms of different species of poisonous snakes are vary in toxicity, composition, antigenic structure, and they vary in composition also. It is basically a mixture of toxalbumins, enzymes in varying proportions. The enzymatic components causes local and systemic effects, and non-enzymatic components produce lethality of the snake venom. Venom is water and alcohol soluble, and venom travels in the body through lymphatics and superficial veins and spreads rapidly through subcutaneous areolar spaces. So usually whenever the snake is bitten, it usually travels to the veins or lymphatic system or through the skin. By necroting the skin, it may spread. Coming to constitution of a snake venom, the first is the combination of proteolytic enzymes. So proteolytic enzymes degrades the usually liberates histamines, causes digestion of the tissue proteins, peptides, produce edema, blistering, burn, bruising, and necrosis. So usually proteolytic enzyme causes degradation of muscles, any peptides, any part of cells consist of proteins are degraded. Next, there are fibrin ferments enhances the coagulation process. Neurotoxins which are found in elapids. So common example of elapids includes the cobra and the crate. So these are which is present in India. Cobra and crate are neurotoxins. So they are neurotoxic and they produce symptoms of paralysis. Or produces curare-like effect and paralysis, especially of respiratory symptoms. Cholinesterases is rich in venom. Cholinesterases inhibit the cholinesterase enzyme, so it increases the acetylcholine which is present in the neuromuscular junction. So neuromuscular acetylcholine will present in neuromuscular junction, continues to invade the muscle nerve endings. It is rich in venom of cobra and crate, leading to impairment of neuromuscular transmission. Then hemolysins, mainly in the vaporine venom. So vaporine venom like Russell viper or saw cell vipers are hemolysins, causes disruption of endothelial cell functions, locate the site of bite, causing hemorrhagic edema and systemic bleeding, leading to shock. Then next form of constituent is a cardiotoxin, which is particularly in cobra venom, which is toxic to heart and other muscle tissues. Next is cytolysins, mainly seen in the viper venom, causes lysis of cell structures of blood and tissues. Agglutinins causes agglutination of red cells, leading to clots. Acetinases act on the lipid layers, leading to toxic that it increases the fragility of and permeability of leakage of cells. Then phospholipidases acts as a catalyst in hydrolysis of lipids in nervous tissue and alters the neuromuscular conditions. So they degrade the hydrolysis the lipids which is vital to the cell structure as well as on the nervous tissue and alters the neuromuscular conduction. Then phospholipidases causes hemolysis. Proteinases causes like trypsin like action causing tissue damage. Then hyaluronases helps in rapid spread of the venom. It is present in all venoms. This is the one enzyme which is present in almost all venoms. It causes subcutaneous tissue degradation and it helps in spreading of venom. Then ribonucleases and deoxyribonucleases present in all venoms help in rapid spreading of venom. Then opioid oxidases helps in autolysis. Proteases causes dissolution of vascular walls. Then other constituents include biological amines such as histamine, 5-hydroxytryptamine may contribute to local pain, permeability changes at the site of bite. Next, enzymes. So next constitutes those are the toxicological enzymes, which includes phospholipidases, proteases, hyaluronases, cholinesterases, hydrolysis, ATPases, transaminases, phospholases, aminonucleases, deoxyribonucleases. This cause cell wall permeability, hemolysis, leading to necrosis, promotion of IV clotting, and fibrinolysis. Then peptides and polypeptides causes systemic effects. So these are all the constituents of any snake venom. So some have some part. All the toxics, all the snakes have all not have all the enzymes or all toxobomes. Some have specific enzymes, specific enzyme, proteolytic enzymes. Coming to types of venom, the colubran and elapidae venom is mainly neurotoxic in nature. So colubran includes like boom slang snake, elapidae includes cobra and crate, and has primary toxicity for respiratory and cardiac centers. So these elapidae and colubrans are neurotoxic in nature. The neurotoxic features are due to selective D2-glucocaron like neuromuscular blockade, which results in flaccid paralysis of muscles. It can produce marked cardiac and vascular changes or have a direct effect on the blood. So usually causes paralysis. It can affect on the heart as well as the blood vessels. Next is a vaporine venom. So vaporine examples includes like Russell viper or saw cell vipers, mainly hemolytic nature. They cause hemolysis and cause intravascular hemolysis and depression of coagulation mechanisms. Russell's viper's venom contains two proteases which activate the blood clotting cascade. As a rule, one of the nodes of action far exceeds the other. The snakes are venom is myotoxic, so they cause degradation of muscles. The venom of rattlesnakes, cottonmouth, and copperhead contains enzymes that possesses cytotoxic, hemorrhagic, and neurotoxic properties. Coral snake venom is neurotoxic, causing Curare-like effects on neuromuscular junctions and neurological symptoms. We'll continue in the next video.